Hello everyone, I am Dr. Raghav Malik, consultant, cataract and refractive surgical sciences at Center. So today we'll be discussing something really important. So a very commonly asked question or a very commonly discussed topic is myopia. So myopia amongst children is a huge problem these days. It is estimated that more than half of the world's population will be myopic by 20. It is that amount of a problem. So it's very important to know how you can protect your child from myopia. So in simple terms, what is myopia? So myopia basically means minus ka power. That means that the patient requires glasses that are minus power to give the patient clear vision. So there are different types of myopias, but the most common is the axial myopia. That means that the size of the eye, the anterior posterior diameter is increasing. जब साइज हमारी आंख की गोले का साइज आगे से पीछे बढ़ जाता है मिलीमीटर में, तो फिर चश्मे का पावर बढ़ना लगता है. जितना भी हम पास का काम, जितना भी हम छोटे स्क्रीन देखेंगे, उतना हमारा माइनस का नंबर बढ़ने का चांस ज्यादा है, एंड जितना भी हम बाहर रहेंगे उतना चांस कम है. So now, what can your child do to avoid this increase of power? Number one, avoid screen time with a small screen. A TV is better than a laptop, which is better than an iPad or any tablet, which is better than a small phone. If your child has any homework, any screen work to do, it is better to do it in a bigger screen at a much larger distance. The more the distance between the TV screen or whatever screen and the eyes, better it is for the eyes. That's number one. Secondly, if you have any screen time, if you are reading, always do in a properly well lit up room and with a proper posture, with your back up straight. That definitely prevents increase of myopia. So when you look at something at a distance, so more light goes inside the eye, and when there is more light inside the eye, the light is spread through the retina, and then there is no increase in diameter and the power does not increase as much. So outdoor time is very, very important. Thirdly, getting your child screened regularly. Regular checkups are very important. Why? So we know what is the progression of myopia. There is something known as a myopia workup, which we can do, and we can see how the child's eyeball is increasing or it is progressing over time, and if the power is changing. There are multiple factors which we can look at, like the anterior posterior diameter, and multiple more tests which help us give an estimation of whether the power is going to increase or not. That is very important. Do that every 3 to 6 months. And lastly, if your child does have myopia, please correct it. Child who has myopia, if not given proper power, he or she will become antisocial. That child does not respond, that child does not want to go out, does not want to play with friends. Why? Because that child keeps into a small bubble, because minus के पावर में हमें पास का सामान नजर आता है पर दूर का नहीं आता. चाइल्ड अपने आसपास की दुनिया बना लेता है. तो वेरी इंपॉर्टेंट कि पेशेंट का पावर को हम अच्छे से क्रैक करें. देयर आर मल्टीपल ऑप्शंस. इसके लिए एक सेपरेट वीडियो बनेगी वेयर यू कैन हैव मल्टीपल myopia control options, like there are drops and there are glasses. Very important, have your child do a proper eye checkup every 3 to 6 months to see if the power is increasing, and please follow the tips that I have.
Follow Planet Lasik and post your queries to get answers from the experts.